Hey, thanks very much, Jay. We're going to just switch gears a little bit away from the laser parameter discussion and some of the sort of fundamentals of laser treatment towards a discussion about laser training. One of the missions of SOLS, of course, is to educate the general ophthalmologic community. And so I'll talk a little bit about laser training, especially as it relates to postgraduate training, and how teleguidance can also help to support the teaching mission of SOLS. Some of the examples that I'll be giving will be conventional laser examples, but this is certainly applicable to subthreshold laser. Here's my financial disclosures. The relevant one is that I'm a speaker for ODOS. So, when teaching laser treatment, there are a number of challenges. One of which is this is a procedure-based teaching. And so didactics, although very valuable, there are some limitations when we're talking about a procedure-based training. Usually when we talk about procedure-based training, we sort of rely on that old mantra of see one, do one, teach one. And in reality, it's more like you see some and you do many to get to a point where you can also start then teaching others on how to do it. And it's the doing part that's really the most important. And that's the challenging part when trying to teach somebody how to do laser, especially residents and fellows early on in training. The other challenge that we face, especially as educators, is that there's limited opportunity for real-time feedback. Traditionally, the feedback is there's some discussion before training, but then there's the feedback is after the treatment's already been rendered rather than being a real-time process. And then finally, there are wet labs and simulator platforms that are available for surgical training, and certainly for laser training too. There are training eyes for other types of laser, but that doesn't really exist for retinal photocoagulation. And so there are technologies that are available to help support that, specifically the Navigate app, which I'll talk about a little bit later. And then finally, there are multiple platforms, as has already been described by the other speakers. There's multiple platforms and multiple indications, and so that can also be a challenge for teaching. So I'll just talk a little bit about our laser curriculum at UCLA. I'd be really interested in hearing about how others approach training for residents and fellows. But basically, our program is split up into three sessions or three components. There's a didactic component, a laser planning and parameters component, and then a practical. So as far as the didactic session goes, we go over a number of different topics. Certainly the history of lasers, the laser properties. This is a graph similar to what Lite showed earlier regarding absorption profiles for different wavelengths of laser, indications for laser. What are the parameters and what constitutes an appropriate therapeutic endpoint? Obviously, this is for threshold laser, but when we're talking about subthreshold laser, what are the parameters and what are we looking to achieve? There are multiple platforms, and how do those platforms differ? What are the pros and cons of each of those? Other issues like lens magnification. And then finally, we talk about tips for success. So for example, how do you deal with a patient who's particularly photophobic? How do you get a proper viewing if you're experiencing glare? How do you deal with pain, that sort of thing? So after that didactic session, then we go on to our laser planning session. And this is where the Navigate app has been really helpful. We can certainly go over cases in a more traditional format where we can put up pictures and multimodal imaging, fluorescein angiograms, OCTs, and talk about how one would train, how one would plan the treatment rather. But for trainees, I think it's really beneficial for them to actually put finger to iPad or pencil to paper to really plan out what their treatment would be, and then to have an attending there who can then go over that treatment pattern and hopefully have a good discussion about how their treatment plan may differ or provide some feedback. So the Navigate app allows you to upload images, upload cases, upload a variety of images which can then be overlaid, and then plan treatment. And you can adjust multiple parameters like the location of the spots, the spacing, etc. And that's freely available. So for anybody who wants to use this for teaching, it's available on the Google Play Store for free, and as well as the App Store. So this is sort of an example of a case we might present. Again, this is not a subthreshold case, but we would upload in this case a patient who has treatment naive PDR, an Optos color photo, fluorescein angiogram, and I won't play the entire video, but you can, the trainee can then go through and they can plan out the treatment area, and then the attending can then give some feedback about whether or not that's an appropriate treatment. If it's too extensive, not extensive enough, how do you place your spots with respect to, in this case, fronds of neovascularization, et cetera. And it's just another case of a BRVO showing the same. Trainee is given the opportunity to plan out their treatment, and then the attending can then opine on whether or not the treatment was appropriate. And then we finally go into a practical session. So we have multiple laser platforms, both at UCLA itself and our satellite hospitals have multiple platforms. And so it just gives our trainees an opportunity to understand how they can modify all those different parameters, all the different functionality of different laser platforms. So we have all of those in our practical session, so that for our trainees who are just starting to do laser treatment, that the functionality of the machine isn't a source of stress for them. So in terms of our tips for success, we record these training sessions because resident and fellow rotations don't always result in the fellows or residents doing their laser treatment blocks right after our training session. We have them recorded so that they can view them on demand. We like to have smaller, either one-on-one or small group sessions, so that we can have more detailed discussions about laser treatment parameters. We time it so that, for our program, our second year residents are doing the bulk of laser treatments. And so we time this so that it's right at the end of the first year, so that they have this information fresh in their minds, right into going right into the blocks where they're going to actually be administering laser treatments. We like to include people who are a little bit more experienced, senior trainees, attendings, of course, so that it results in a more nuanced discussion. When you're first starting out learning how to do lasers, there's a lot that you don't know what you don't know. And so having people in the room who have a bit more experience can allow for a more robust discussion. And then finally, as with all procedures, it's really important to maintain case logs and look back and see what happened with the patients that you treated. So now I want to switch gears a little bit and talk about teleguidance. Teleguidance isn't really that new of a concept. Back in 2017, Igor Kozak and colleagues described the use, in this case, it was actually the use of the Navigate app, where they were located in the United States and they were using the Navigate app to provide teleguidance for treatments that were happening at King Khalid Hospital in Riyadh. And so what they were able to do is basically have this shared platform where images, fundus photos, OCTs, et cetera, could be uploaded onto the app, and then they could provide their recommendation for how to administer treatment. And I think that this is potentially really relevant for providers, trainees, and experienced providers who are just starting to use subthreshold laser. I know, for example, I've reached out to Jay a few times to get his input on how to approach a patient who has CSR, for example. What would be the appropriate location of spots, and how to actually go about doing it when I was doing my first few cases. And so I think that in terms of adoption of a type of technology or a laser treatment approach that may be novel for some people, having this type of teleguidance can really increase adoption and make providers more comfortable with their first few cases. This was taken one step further. This paper just came out in JAMA Ophthalmology last year, and this was actually something that happened as a result of the COVID pandemic, where experienced retina specialists weren't able to administer treatment in sort of more rural areas of China. And so what they did was they set up a really robust teleguidance system. This was, again, using the Novelos laser, but basically the schematic is below. But basically what they did was they had a retina specialist in Beijing who was able to communicate with the treating provider through teleconference, but that the consulting physician who was remote actually had remote control of the laser, and so that doctor could then actually put in their own treatment plan, and the local ophthalmologist could then administer that treatment under the direct supervision of the remote physician. And this is just a picture of what that looked like. So you see, there's a traditional teleconference that's in place, and the remote physician can actually render treatment. They can put in their treatment plan and monitor the treatment as the local ophthalmologist is actually administering it. Now, this is a pretty sophisticated setup, but it doesn't have to be that way. You know, we're all very comfortable now with teleconferencing, and there are a number of ways that we can connect through teleconferencing, and that paired with the Navigate app, for example, or other image sharing platforms, you could actually have a system like this where you can have experienced providers who can provide guidance to people who are just starting with laser treatments, and in particular with subthreshold treatments. So sort of in summary, I think that laser training really demands a multimodal approach. There are certainly multiple indications, techniques, and platforms, and we can use, I think, technology to support learning, especially as we're talking about expanding the adoption of novel therapeutic approaches like subthreshold laser. Teleguidance can, I think, play a really valuable role. Certainly, as I've described, can play a role for trainees, but also for people who are just new to subthreshold laser. And of course, it can be applied for administering treatment in underserved or rural communities. Thank you. I'm happy to answer any questions.
Go ahead, Viral.
Yeah, Pradeep, great talk. You know, I think there's a lot that you discussed. For me in particular, you know, the question is really around the telehealth and teleguidance. And my real question is, during the last couple of years with the pandemic, did you see a change or a push or kind of almost a catalyst in driving this type of technology forward? Because I think in general, we saw telehealth take giant leaps forward during the last few years. And I'm curious to see what your experience was in the last few years, especially as far as the adoption of this.
Yeah, no, for sure. I think that as you said, teleconferencing in general, just as one example, everyone is now so comfortable with teleconferencing, whereas you know, in the past, prior to the pandemic, I mean, people may have been familiar with it, but it's not as widespread as it is now. And so I think this idea that you can be, you know, productive in meetings, or that you can actually provide, in this case, educational guidance remotely, is something that is more accepted. We at UCLA, we haven't had so much of an issue because our providers are all local, and so we haven't really had a need. But I do think that, generally speaking, this paper that came out of Beijing is a great example of that. This is something that was an offshoot of the COVID pandemic and limited access that patients had to experienced providers. And I think that we can leverage that opportunity to expand the training and comfort level, I think, of providers who aren't familiar with subthreshold laser. Maybe they didn't have that as part of their training, and maybe they're doing their first few cases and then just want somebody else who's a bit more experienced to give them a little bit of support. I think that as a society, if we want to try to encourage more adoption of subthreshold laser, in addition to all the other things of providing level 1 evidence, et cetera, I think having, you know, teaching or access to experienced providers could be really impactful.
Yeah, but thanks, Pradeep. And this is exactly in Seoul's meetings, we have been discussing that how can we incorporate this teleguidance to our members, and you know, we can help them we can just help them even treating their routine patients, as well as to implement this into a research platform. So yeah, there is definitely a lot of potential for this. Excellent talk. Thank you. Detail?